So radiation treatment has evolved tremendously in the past 2-3 decades. A large proportion of that has been just from advances in technology. So we used to treat with live radioactive sources within the machine. We don't do that anymore. So, the machines that we have are linear accelerators. They don't actually have a radioactive source within it. The other is that we use three-dimensional images to generate radiation plans. So again, in the past, we used to take X-ray films and draw out the areas that we were going to block with radiation beams. It used to just treat a very broad area of the body, and so it had a lot of side effects because where the tumor was, there was also a lot of normal organs and tissue that would get radiation treatment, the full dose of radiation. So since that time, we've developed CAT scans. So much like many people know, when they come into the hospital, they may get a CAT scan done. We essentially use that similar technology to plan our radiation treatment. So patients, when they're getting radiation treatment, for a vast majority of them, they'll get a CAT scan done prior to radiation. And we take all that information, so that essentially the three-dimensional information from the CAT scan, and myself, along with a number of staff, essentially draw out or identify the area where the tumor is, where at-risk areas are, so some of the lymph nodes or areas where it can spread. And then also draw all the other normal things that I want to avoid, so things like the heart, the spinal cord, the lungs, things of that sort, and plan the radiation treatment so that we can actually capture numerically how much of the radiation dose is going to a certain area, plan the radiation accordingly, make sure that we're adjusting or blocking for that measure. A lot of people don't think about kind of all the advances that we've had, the ability for me to show them the scan and the plan for the radiation treatment and for them to see exactly where the radiation dose is being delivered. I think that is something that it seems that most patients don't anticipate, and when they are able to see it, I think it makes them feel a little more at ease sometimes.